Hello, everyone. My name is Sue Ross, and I'm Director of Admissions for Tulane School of Public Health and Tropical Medicine. And today's guest is a current student, Gloria Kalong. Would you like to say hello, Gloria?
Hello, my name is Gloria Kalong.
And where are you from, Gloria?
I'm from DRC. I came to Tulane in 2017 for IHG.
For your program is IHD, right? And
Yes.
that is
International Health Development.
very good. And so we were chatting the other day, and you told me about your practicum experience.
Yes.
So, and what did you do for your practicum? Where did you go?
I returned to my country, Democratic Republic
Excellent.
of Congo.
So you got to go back home
Yes.
to do your practical experience. And for us, that's an international practical
Yes.
experience. So part of your curriculum here is to complete a practicum or an applied practice experience. And that's where you use the skills that you acquire in the classroom and put them into practice in the field. And we always want you to get the type of practical experience that you want. So how did you obtain that practical experience that you went back to your country?
Well, I wanted to do an international practicum. Our school had a guest speaker, Dr. Zeno, coming from Congo, since he was speaking about the analysis of data collected for family planning in DRC. So I went to the event. So I liked it. I was very interested for that, and it was from my country. So after this, his talk, I was able to connect with him, and he put me in touch with program representative so that I could get my practicum back up.
Wow, that was excellent. That timing worked out for you. Well, what did you do in your practicum? Tell me a little bit about it.
So I work on two separated areas, reproductive health and the adolescent health program. And I also attended workshops.
So in the adolescent health part of your practicum, tell me, what did you focus on?
For the adolescent health program, I was focused on a part of Momentum project, which is the Tulane University project in DRC, target adolescents and young adults for 15 to 24 years old, first-time mothers. I was working with my preceptor specifically on data collected about interview of healthcare providers in health facilities with regard to girl for 15 to 44 years old, mother for the first time. The goal of this work was to learn qualitative analysis and to be able to do an action plan.
That sounds very good practical experience in the field. What was the age group of the young mothers that you had?
15 to 24 years
24.
old.
Okay. So you said there was a workshop that's associated with the practicum.
Yes.
Can you tell me what happened during the workshop?
For the workshop of the Momentum project, I attended two workshops. One of them was the workshop we work on the progress of the project, updating documents like some registers and guidelines. And we also discuss about the healthcare of newborn. So we reflect about associate some other communities in the program.
Mm-hmm.
So I learned to reflect as a team. So when there is some problem to resolve, so it was interesting for the first one. And the second one, it was a training of trainers about Program P. The Program P is a part of Momentum program. The Program P is a program which aims to involve male partners in health of mother and children.
Okay.
The goal is to make trainers able to train nurse students, and we will work with the support group. And so those nurses will do what we learn. So they learn from us, and they will like leading session with supporting group of male partners.
That's excellent that you, in the workshop, they train you to deal with the infant, the newborn, and health care for the infant, and then also involves the male partners. So it really encompasses everyone.
It's important for the project, yes.
Very good. You said that there were two parts, the adolescent health, but then also reproductive health was involved in part of the practicum.
Yes.
Tell me a little bit about the reproductive health part.
So for the reproductive health, I learned more about family planning concern in DRC. I participate in some daily activities of the clinic of family planning in the reproductive health program. I learned how to counsel mothers who elect to use contraceptive methods. I learned about those contraceptive advantages and disadvantages. And I assisted also in providing contraceptive and how to remove them.
Okay, very good. And then there was a workshop associated with that part, the reproductive health too. So what did you learn in the workshop for that part of the practical experience?
So I attended a lot of workshops there, and most of workshop that I attended, it was the workshop session on capacity building for sustaining permanent multisectorial technical communities. So we call it CETAMP, is the communities which work with government, Ministry of Health, national and international partners working with family planning program concern. So the objective of this workshop was to build the capacity of CETAMP members. So for their roles and responsibility, develop a work plan. So we also work about updating the strategic plan of family planning in DRC. So this strategic plan have like some specific objective that we have, like seeing it in group hours working thing, and if something was done, or if we have like to do something else, or what we have to update. So I learned like how to reflect as a team member.
Excellent.
So and I discovered that we have like many problem in concerning family planning. So the lack of a contraceptive, how to do when we have a lack of contraceptive, and also how to do to spread the CTMP committees in other province. So like to make it like more stronger, because in this committee, so also we have like mobilization of resources. So is a lot. So I've learned many things there.
Okay, so you mentioned CTMP, and that's the acronym for the program, which is a multisectorial technical.
So it's the community that is working with Tulane International in DRC, together, so in collaboration with the reproductive health program, and also what I say before, government, Ministry of Health, and partners, international and national partners.
So many partners involved in this initiative.
Yes.
And it looked at lack of contraceptives and lack of supplies.
Yeah, and so we see in which level, if we have like a lack of contraceptive, in which level is the problem. So I was like in the same time discovering. So, and the thing that I also enjoyed, that in the end of my practicum, we like attend, like one of the objective is like to build, like to bring in the government like a family planning program, to make the family planning like a priority in the DRC. And that was, it was done, and we saw that in the speech of our president, and it was so amazing to see that we obtained some result of our objectives. So it was very interesting.
Well, it definitely sounds like you enjoyed this work. And what did you learn?
in general.
Yeah, and just in general.
Yeah, so in general, for both program, I learned how to do like analysis, a qualitative analysis
Very
in
good.
data, in collected data.
Mhm.
I learned how to work as a team in workshops, how
Mhm.
to reflect, and also I made some reports. In every most of workshop, I have like to do reports and like to
Right.
to discuss with my preceptor. It was so the main things, I guess.
Mhm.
Yeah.
Okay. Well, how do you feel that having a degree from Tulane will help you in your future and your career goals?
This degree will help me to work as an expert in public health around the world by giving me skills and experiences with real world issues.
It sounds like you've already obtained some of those. Well, Gloria, we just started a new semester. What's up for you for this semester?
I'm starting my second year and I have 4 classes. And among those 4 classes, I have also like adolescent health and health problem in developing societies. So I guess those classes very important, and I will like go further with what I learned in my practicum. So to be like open mind and to see realities in another world. So it's interesting. Yeah.
Okay, so when do you plan to graduate?
I plan to graduate at the end of next year, probably, because I supposed to graduate in May, but I guess I will extend. It depends on the way that I'm taking classes.
Okay.
Yeah.
Well, it sounds like you've had great experience. I really love hearing about that, your practical experience, that you got to go home and spend your applied practice experience there, back in your own country. And I enjoyed having you here today. And I wish you all the best in your future.
Thank you, Sue.
Thank you. Okay, bye-bye, everyone.
Bye.
I want to end this.